Welcome. Today we will be discussing the 2019 update to the physician and nurse discharge workflows. This video provides the reason for the change, new components in the physician workflow, review of producing the clinical summary, and how the workflow was compiled for the patient at the time of discharge. Finally, this video provides the methods to improve the process in the future. Since go live, many have identified areas where the existing discharge process and documentation had opportunities to improve. During the sprint session held in April of 2019, a multidisciplinary team assembled to provide input and approve this update. The physician workflow has minimal changes. The biggest change are the 4 new components added to provide clarity to the patient and to the multidisciplinary team. First, the discharge planning component. This provides anticipated discharge date, where the patient is anticipated to discharge to, any special equipment needed, any professional skilled services required after discharge, or special services or community resources needed. Further down, we have goals and interventions. In this is designed for your opportunity to provide goals to the patient in order to improve their overall health status after discharge. Use the plus sign to add new goals as needed. Next, we have the patient instructions. This is your opportunity to speak directly to the patient in plain language what they are to do after discharge. Finally, we have hospital course. Within hospital course, this is a multi-contributor component which incorporates the multidisciplinary team input to discharge. This component outlines the patient's hospital course from admit to discharge. The discharging provider makes final edits, which are then saved in the final summary. Once this is complete, we can create Discharge Summary. This is the dynamic documentation that pulls from all those components throughout the workflow, as they can go through and use their standard dot phrases and as you type to make it easier. Once it's done, sign and submit, and it's a discharge summary and sign.
The inpatient discharge instructions has the following components. What to do next. This is comprised of instructions from the provider. This tells the patient what to do in plain language. If they have already scheduled appointments, they will show up here. If the patient needs to schedule appointments, it will show here. In the follow-up section, if we would have said somebody was going to call the patient, that would show here. If there has been home equipment or services or treatments, those also would populate here. Moving down, you have the information for the visit. Who took care of the patient, the admitting diagnosis, the final diagnosis, the goals identified by the provider and the multidisciplinary team, tests that were performed, the medication list, and procedures. Also, from the eye view, you will see the discharge vitals. Moving down, you'll see the medication section has a table. In red, you will see unchanged if the medication is unchanged. If it is a new medication, it will say new. If the patient has discontinued medications, a second table will show up beneath this primary table that will say, stop taking these medications. If there are any test results, they will show here. If you have immunized the patient utilizing barcode medication administration, they will show here, and any allergies previously charted on the patient, the patient's problems list, and any devices that are implanted or removed on this visit. Following all of that is the education materials provided to the patient, and below it are the CMS mandated education contact information. This complete documentation provides a clear, readable methodology to relate to your patient how to best take care of themselves following discharge.
This is an ever-improving system. If you discover an element is not working appropriately, please log a JSC ticket with Discharge Update in the summary field. If you have a recommended improvement, please develop the recommendation and route through your ISB or ISC for analysis and approval to then submit a change request. The DHA Health Informatics team will then prioritize and work collaboratively with our VA counterparts to implement those changes. Thank you for your time.